Good evening. How are you? Uh, Today we will start again our day 15 of daily NEET PG uh, postings and live stream. And today we will be discussing about the 20 questions which we are posted in our Telegram channel. The Telegram channel is Medaffin Academy. Medaffin Academy, and you can find the QR code here. Just scan the QR code and you will be part of our Telegram channel. Okay, we have been posting for last 17 days in Telegram channel, and we have been doing live streams for last 14 days, and today is 15th live stream, and we will be doing these live stream continuously going forward. The plan is same. We will post questions in the Telegram group, we will discuss the questions in the live stream, and the answers along with the explanations will be published as a PDF in the Telegram group at around 10 p.m. daily. So if you are part of this group, you will be getting high yield MCQs daily, and also you will get to know which areas most of the students are getting wrong, and you can concentrate on those areas so that you can score more marks in that area. So the group is open, so just scan this QR code, or let me also copy the link. Yeah, you can also click on the link which is available here, and be part of our Telegram channel. So what we do every day at 8 a.m. we start our first question, then at around 5:30 p.m. we'll stop our sessions. Every 30 minutes we will have our session. We will post our questions, and at we will give you time till 7:30 p.m. to choose your answers. So what we suggest is, like, even if you don't come to the channel, or if you have break times, just come to the channel, answer all the questions which are posted till then go back and do your work, and study yourself, and come back at 5:30 6 o'clock and start reading all the questions which are there or pending, answer them, right? So, like, it's a 10 to 15 minutes exercise for you, but that definitely will be kind of revision for you, right? And at 7:30 the poll closes, and 8 p.m. we will start our live stream. That's a daily thing, and you can find the other live streams in live section of my YouTube channel. If you are not a subscriber, please do subscribe to my YouTube channel. So without further ado, I think it's already 5 minutes past our start session. Like, we will start with the first question. The way we go with the questions is simple. We don't explain the answer, we will just explain the question, the right answer, how much percentage it was marked as right, and what is the percentage it marked as wrong, so that you will have a brief idea. So coming to the first question, pap smear of a patient revealed hyperchromatic nuclei, irregular nuclear borders, and low maturation index involving the whole thickness, but did not breach the basement membrane. What is the diagnosis? Okay, uh, almost 72% has given the right answer, that is dysplasia. Rest 28% has given answers as hyperplasia and carcinoma. The correct answer is dysplasia, right? Coming to the next question, this is the image based question. We do post somewhere around 8 to 9 image based questions out of 20 per day, and the reason being, like, we are expecting more image than video based questions this NEET PG. Out of 180 we are expecting somewhere around 40 to 45 will be image and video based questions. So if you are part of these groups, you will have more exposure to image based question. Even just in 17 days you will be seeing somewhere around 100 to 200 image based questions easily. Coming to the next question, which type of joint is present at the arrow, this arrow shown in the X-ray pelvis? So 86% has given their answer as secondary cartilaginous joint, and that's the correct answer. Okay, that's the correct answer. And 14% has given the answer as fibrous joint. Okay, the correct answer is secondary cartilaginous joint. Coming to the third question, 32-year-old unmarried woman came with secondary amenorrhea. She was having regular normal flow periods until now. Nothing was found on pelvic examination, no other associated complaints. What will you do next? Okay. So the answer 67% has given the right answer, that is urine HCG, that is pregnancy test, urine pregnancy test, and 33% has given the answer as LH and FSH testing. Okay, the correct answer is urine HCG. Do the simple things first, then go for complicated things. Coming to the next question, it's just a request. So if you are watching this live YouTube stream and you are not part of our Telegram channel, or you didn't subscribe to my channel, YouTube channel, please I request you to subscribe to my YouTube channel or join our Telegram channel, so that definitely this is going to help us and also you. So the reason being, like we said, we have intention of posting somewhere around 1500 high yield MCQs by the end of August 29th. Coming to the next question, it's a single sentence question. Killian dehiscence is present in. 17% has selected their answer as superior constrictor muscle, and 83% has selected their answer as inferior constrictor muscle. Okay, the correct answer is inferior constrictor muscles, right? That's the correct answer. Coming to the next question, we do have another image based question. If you see, this is a marking and this is the structure which is slightly swollen and which is also pushed into middle of oral cavity, not oral cavity per se, in the pharynx, right? A 9-year-old boy comes with complaints of right ear pain. So right ear pain, difficulty in opening the mouth, painful swallowing, and fever. The oral cavity examination reveals the following. This is the oral cavity finding. There is a swelling which is pushed into the midline. The external facial examination is unremarkable. There is nothing on the external fascia, only internal. You can see that. Which of the following is likely? If you see, almost 80% has given their answer as quinsy, and that's the correct answer. Quinsy is the correct answer, right? And the other answers are parotid abscess. The problem with parotid abscess is you will have facial changes also. There will be swelling on the face on the right side, I mean right side, because it has right side issue, right? So the correct answer is quinsy. The other options are pharyngitis and Bezold's abscess, and these are not the correct answers. Okay. So for you, if you want to have more answers, like I suggest you come to the channel, and at 10 p.m. we'll post all the questions, their answers and explanations. So if you want to see how the explanation will look, this is how the explanations will look. Every question will have a detailed explanation, and I think that will be a good reading material for you, right? Yeah. Coming to the next question again, which of the following is most likely to be associated with vaginal pH of 4? Okay, that's a question. We have four options again. 40% has chosen the answer as atrophic vaginitis, 20% has chosen the answer as trichomonas vaginitis, 40% has chosen their answer as candidal vaginitis, and the correct answer is atrophic vaginitis. At the starting of atrophic vaginitis, the pH will be slightly acidic. That's the correct answer. Okay, and full explanation is given in the PDF. You can just be part of our group and you will get access to the PDF at 10 p.m. Coming to the next question again, what is the most frequently reported symptom in the patients with nasopharyngeal carcinoma? That's the question, and we have the options. Cervical lymphadenopathy, C is missing. It's a clerical mistake. 60% has given the answer as cervical lymphadenopathy. 20% has given the answer as hearing loss. 0% airway obstruction, and 20% has given their answer as epistaxis. The correct answer is cervical lymphadenopathy. Okay, cervical lymphadenopathy is the correct answer, and yeah, 60% has chosen it correctly. Coming to another question, again an image based question. Next, this time it's a pathological slide. Pathology slide. An elderly man presented with retroperitoneal mass. Sorry, biopsy from the lesion is shown in the image above. Molecular analysis revealed T12 and 16. What is the most likely condition? 66% has chosen their answer as myxoid liposarcoma, and that's the correct answer, right? That's the correct answer. So, the 17% has chosen spindle lipoma, another 17% has chosen polymorphic lipoma. Okay, the correct answer is um, spindle lipoma. Coming to the next question, again, a young female presented with abdominal swelling. The swelling was moving perpendicular to the line of attachment of mesentery. What is the most probable diagnosis? Okay, we have four options. 83% has selected their answer as chylolymphatic cyst, and 17% has selected their answer as peritoneal cyst. The correct answer is chylolymphatic cyst. Okay, so 83% selected the answer. Coming to the next question, it's not question again, it's a request from our side. Please help us grow this channel, share this link which is posted in the live chat, subscribe to my YouTube channel, that will encourage me to produce more content free for the benefit of NEET PG preparation aspirants or NEET PG aspirants. Coming to the next question, in the colon, flask shaped ulcers are caused by. We have four options again: Entamoeba vermicularis, Giardia lambia, Helicobacter pylori, and Entamoeba histolytica. The correct answer is Entamoeba histolytica, and everybody has selected the correct answer. That's 100% strike rate. So it's an easy question then. Coming to the next question again, a man working in a mace as a mason in Rajasthan develops dyspnea after 15 to 20 years. So he is working in Rajasthan. That's a clue, right? Which of the following may have contributed the same? Correct answer is silicosis, because he may be exposed to severe, sand particles, and he is also working as a mason. Silicosis is the correct answer. 83% has selected it as silicosis, and only 17% has selected as asbestosis. The rest two options are anthracosis and bagasosis. And bagasosis, anthracosis are not part of, not particularly related to this presentation. Coming to the next question, again an image-based question. An elderly man presented with fever, altered albumin globulin ratio and urinary proteins, and has multiple punched out lesions on x-ray of skulls. Okay, these are the punched out lesions, right? There is a lesion, like, you know bone is taken away, right? So what is the likely diagnosis? 72% has selected the answer as multiple myeloma, and that's the correct answer. 14% has selected as Hodgkin's lymphoma. Another 14% has selected answer as Paget's disease, and Paget's disease is also a bone disease, but answer here is multiple myeloma, because he also has, deranged albumin and globulin ratios and urinary protein bodies, right? Coming to the next question, again another image based question. You can see this is the CT scan image. You see they are showing a lesion in the liver, right? And it's a contrast and non-contrast CT scan, right? A chronic alcoholic presented to the OPD with a history of pain in the right upper quadrant. Okay. On examination, hepatomegaly was seen, and CT scan, the following findings were observed. Okay. The best management in this condition would be, we have four options. One is pair. Okay, the which is actually percutaneous aspiration, injection and reaspiration. Okay, the other options are surgical management, and the other option is angioembolization, and fourth option is reassurance. What is the correct answer? 60% has selected it as pair, and pair is the correct answer, right? It is actually a hydatid cyst. Hydatid cyst. Okay, the treatment for this is pair, percutaneous aspiration and injection and reaspiration. Coming to the next question, a child was brought to emergency with generalized tonic-clonic seizures. Which drug should be given first to control his symptoms? We have four options: valproate, diazepam, phenytoin, and haloperidol. The correct answer is phenytoin, and that's the first choice of drug, and almost 75% has given their answer as phenytoin. Coming to the next question, again another single line question. Double depression in Okay. So we have four options. Almost 100% has selected their answer as depression with dysthymia. That's the correct answer. And for the full explanation, you will find it in PDF, which will be posted around a 10 p.m. today. Coming to the next question again, during an antenatal visit of pregnant lady of 20 weeks, the fundal height is only 16 weeks and USG shows no amniotic fluid. Okay, which abnormality is likely to be seen in the fetus? Okay, the correct answer is renal abnormalities because amniotic fluid formation is even through the fetus urinating. That is also one form of amniotic fluid formation. So the correct answer is renal abnormalities. Coming to the next question, which 100% has given their answer. Which of the subsequent options is not examined by fast ultrasonography UC? So fast scan, what are the things which are not examined in this particular diagnostic method? The correct answer is pleural cavity is not examined, and 60% has given their answer. The rest has given their answer as spleen and liver. The correct answer is pleural cavity. Coming to the next question, and this is last but one question. It's an image based question again. It's a lengthy question, right? So you see, from here to here is the question. A woman on treatment for infertility came with 6 weeks of amenorrhea, abdominal pain, and mild vaginal bleeding. Her beta HCG level was 2800 microunits per ml on ultrasound. A 3 centimeter mass was seen on left adnexa. It contained gestational sac with no fetal cardiac cavity. What is the most appropriate management for this patient? Sorry, this is a different question and this is a different question. Sorry. Okay, what is the most appropriate management for this question? The correct answer is single dose methotrexate. Okay, and almost everybody has selected the correct answer, single dose methotrexate. So it's actually ectopic pregnancy. We have a image based question. It's CTZ. During your labor room postings, you perform a topography CTZ on a woman who is in labor at 38 weeks of gestation. The tracing that you obtain is shown in the image above. Which of the following may cause this finding? If you see, this is a uterine contraction. The fetal heart rate is dipping here. So if you see the exact line, the fetal heart rates are actually decreasing after the uterine contracts. So these are late decelerations, right? So late decelerations occurs in which of the following? Is it in placental abruption, excessive use of oxytocin, epidural anesthesia, fetal head compression, umbilical cord compression? Okay, the options are either 1 to 5 or 3 4 5, 1 2 3 1 3 4. The correct answer is placental absorption. Excessive use of oxytocin, epidural anesthesia causes these kind of late decelerations, and these are the reasons for this particular type of picture in uh, late deceleration, right? The correct answer is 1 2 3. Coming to the next question, this is actually an video based question. I don't know, you can see the video. Let me just, yeah, see, there is a trauma case and he is trying to breathe. Okay, a 28, I'm expanding it, but maybe you will not be able to see it. A 28-year-old male patient is brought into the trauma bay after high speed motor vehicle collision. The video demonstrates the paradoxical inward movement of lateral chest wall during inspiration. During inspiration, the chest wall is going inwards. That's a paradoxical, right? Outward movement during expiration. When you are breathing out, the chest wall is moving outside. So what is the most critical initial step in the management of the specific breathing abnormality? The correct answer is actually positive pressure ventilation with adequate analgesia, and almost 4 or 100% has given their answer correctly. Okay, so this is a very Easy question. It's a paradoxical breathing. He has trauma. He has a flail chest. That's the diagnosis. And in flail chest, the treatment of choice is pulse to pressure ventilation and analgesia. Okay. And yeah, that's it for today. Uh, so if you are watching, if you are if you happen to watch, please subscribe to my YouTube channel, give it a like, thumbs up, comment below, share with your friends, and join our Telegram channel just by scanning this QR code, or there is a link in the live chat, and we will also post the link in the comment, and there is also a link in the description of live YouTube video, so you can click on anything, be part of our Telegram channel. We are not selling anything. You can come confidently. We are doing it just for the benefit of NEET PG aspirants. So no selling, no requirement for you to be buying anything from us right now. So we don't want to do it for 2026. It is just done purely for the benefit of NEET PG aspirants. Okay. Yeah, so that's it for today. I think we have completed it very fast. The reason we do it very fast is like it's just explanation of questions, percentage of answering, right, whether right or wrong, and whether it's an important topic or not, and the explanation anyway you will get in the Telegram channel. So subscribe to our Telegram channel, and see you tomorrow.